Dear colleagues, hello. Ekran дұрыстап қоясызшы. My name is Mynzhylky Berdikhojayev. My first assistant, Kamiljon. My first assistant, Devlet Suyumbetov, and assistant number 2, Kamiljon Abdusamadov from Dushanbe. Yes, and we are from Almaty. This is a presidential Affair Administration, Republic of Kazakhstan Medical Center, National Hospital. It's very complex naming, post-Soviet complex naming. Kamiljon came especially 4 days before the next conference on Saturday. We annually organize the discussion NERA course since 2016, and this year the conference number 10. It's a 10th discussion NERA course conference. One of them was in Astana, and another 8 were in Almaty. And this is number 10. Discussion NERA course conference usually in November, December. This year, December 13, 15. Yes, this screen settings. Now we have patient, lady, 51 years old, with unruptured IC aneurysm. Slight stenosis on the right carotid. I think it's no problem. This is a sizing of the aneurysm. First of all, we will try to do balloon assist coiling. Because of the limited budget for the December, we will try to do as much as possible with the lower price, but with long-term stable result. It's very challenging when the economists clarifying the medical treatment. Yes, it's not about the medicine, it's about the economical challenges. Okay, there is a stenosis, no problem. On the linker Seite. On the left side, there is a ACOM aneurysm. Patients were previously treated after attempt of coiling and wrapping of the vertebral artery on the right side. Yes, we treated this patient in Karaganda city together with my colleagues long time ago, after microsurgery, which were unsuccessful. We made a stent assist coiling. This is after coiling. Leo baby stent and the coils inside the aneurysm. It was partially coiled, dissecting aneurysm, and now you can see aneurysm is occluded with no problem, and this was ruptured. And now patient came with the ACOM aneurysm. It's look like this, down oriented. Yes, it's better if we place stent after, but then we will increase the price of the treatment if we will place the stent. But for long term, stenting is better. Okay, It was attempt of clipping for the vertebral artery without success, and we did the stent assist coiling. And now we'll treat the ACOM aneurysm. Let's see the 3D. 3D looks like this. In this projection, it looks like aneurysm, but it's just MCA. The beauty of 3D angiography. Huh? This is aneurysm. It's something like this, I think. It's overlaying. It's something like this. Maybe like this. Ah, this is better. I think this is better. 68-13. Yes, 68 left, 13. It's nearly this projection. Dawlet already made an angiography in this projection. Let's see. The aneurysm is approximately, yes, it's this projection. Approximately 3 millimeter. Yes, it's 3 millimeter. On the lateral view, it's also 3. Okay. The first coil will be Optima millimeter never. Okay. Now we need to prepare the balloon. Balloon will be Eclipse, double lumen. Қанша? 3'te 6 біреуін бере сал. 3'te 6 is 3/6. In Turkish language will be the same. Жақсы. Yes, we need one more Y connector here. And we need normal. No, it's normal. We need one more Y connector here. Okay, I prepared 60%, 3 cc of contrast and 2 cc of saline. It's a coil, yeah, coil. Now I will take my balloon like this. Just will flush it with water. Система. That's the flushing system. It's a little bit different than I saw from the colleagues from Bicêtre Hospital in Paris. The team of Professor Jacques Moret and Laurent Spel. We placed the flushing system. It's our habit we learned from Shimon Maimon. I think in many places like this, just inflate and we need to take out the air bubbles from the dead space. Now contrast is coming. And the first we need to flush the dead space. And also I have seen 4 or 5 times when it was damaged and contrast is leaking from the balloon. It's very important to check before placing inside the body of the patient. Yes. After filling the balloon, we place tip of the balloon inside the saline, pure saline, and now we'll flush it. We'll place first balloon and then we navigate with same headway Chikai Black. We will navigate the headway 17. Okay. Short sheath from Teruma. It's a Fubuki angled 7 French 100 centimeter. And 2 Y connectors from Balt company. I like these Y connectors, but time to time we use this Y connector. It's also good. Specially placed 2, one with tail. It's very comfortable because it's my habit. Maybe in other places it's a little bit different. We prepared Eclipse double balloon which is 6 by 15, and we took a Chikai Black we do J curve. Yes, it's better to place Check-I black in contralateral side to secure, but I think it will be okay. We'll place it in ipsilateral side. And for the coiling, I specially asked to prepare the headway 17, regular one. If it's needed to place any kind of stents, the headway 17 is more suitable. In my practice, maybe in other places it's different microcatheters, but to place the Pegasus stent nowadays it's also possible through the headway duo. But if it's needed to place Elvis Evo, for the Elvis Evo headway 17 is better. Also for the Silk Vista Baby headway 17, it's my favorite microcatheter. We used gamma, but in a couple of cases, in last couple of cases, gamma stuck inside the. No, contrast. In couple of cases, gamma stuck. Elvis Evo stuck inside the gamma. That's why we stopped to use the gamma with the Elvis Evo. And also with Silk Vista. We sent those. We sent those stents to microvention stents with the microcatheter, and the same answer was in both times. The dedicated catheter for the Elvis Evo from the company, recommended catheter from the company, is headway 17. The other catheters is not suitable. That's why they said we are very sorry, but you should use the dedicated catheter. But first Elvis Evo in Kazakhstan were placed through the gamma 17. That's why. Sometimes it's possible to place it through the gamma 17. Not all time, but sometimes it's possible. Okay, now catheter. Yes, it's ACA territory. It's a contralateral ACA. Okay. The catheter in contralateral ACA through the ACOM. Now I will try to bring my balloon. Yes, now we're distal with the wire. Ah! Why it happens like this? Okay, let's try to navigate the balloon to the ACA territory first. Then it would be easier to navigate the. Okay, now it's easier. Yes, the answer was dedicated microcatheter is headway. That's why we changed our practice, and now more and more we use a headway 17. Also in Uzbekistan, during the placement of Pegasus stent, we had several times problem with the echelon. That's why we stopped to use echelon with Pegasus, and also a couple of times was problem with the Leo baby through the echelon. I don't know why. From the beginning of my practice, Leo baby usually very smoothly goes through the echelon. But something happened in the construction of the microcatheter. From my personal point of view, maybe in different places it's a little bit different. That's why in Uzbekistan, in Tashkent, together with Medicover company, we changed our strategy, and now we start to use Phenom microcatheters, Phenom 17, for the echelon and for the Leo baby and for the Pegasus stent. Yes, it's our observation. Maybe in different places the quality of echelon is different, but in our practice it was like this. That's why we decided to change our strategy. Okay, now wire goes directly to the aneurysm. Okay, now it should go. Yes, also with the Chikai black, it was observations that the Chikai black start to be a little bit sticky at the point of okay, now it's inside the aneurysm. Okay, when you play with the micro, with the balloon, the catheter goes to the correct direction. Okay. Yes, with Chikai black sometimes it was the same observation that the tip of the wire was looked like a little bit taller than before, and it was some problem during the tip navigation. But nowadays everything looks became normal. Okay, we placed the wire especially for the stabilization. Stabilization of the position of the microcatheter. Okay. Now we took a 3x6 complex, да? 6, Yes, it's a complex 10. Yes, so all is material, all is plastic, and everything might happen during the shipment and delivery process. That's why. Yes, we communicate with the companies, and we all the time doing the paperwork when the instrument is non-correctly behaving. And thanks to our partners and the companies, they are answering very fast. Yes. The next coil will be 2x6. The first coil is 3x6. Yes, it would be the same complex, super soft. Patient already on dual antiplatelet therapy. Brilliant aspirin, right? Yes, because of the first stent. Yes, the first aneurysm were treated in February, and this is the second session. Okay, let's do smoke mask. This is the second session, and yes, it went more than 10 months from the first treatment, and aneurysm is stable occluded. Okay. Do we need to place one more or enough? Bir жарым екі var mı? Yes. Жоқ, кішірек керек. Bir жарым екі. Bir жарым үш бересің. Okay, we have a 1.5 by 3. Maybe 1.5 by 2 better. Microplex perisish? Yes, the microplex 1.5 by 2 hyper soft helical. Bir жарым екі, астында. Я сөзді. Ана спиральдар жылшып жіберсін. Мына жағын жылшытасы. Я с вами. Сөйтке бір. Yes, it was a game Tetris when you work with the boxes. It's very helpful to know the principles of Tetris game. All boxes on the shelf, and when you need to have a free space, it's like from the game. Okay, computer game, Tetris. I think many people played Tetris. No? Камилжан, Tetris. Do you play Tetris? Tetris играл? Игра Tetris была. Кубики переворачивать и в пустые места. Yes, Камилжан has experience with Tetris also. It's in Tajikistan. And I think the same Soviet Union. Когда родился Камилжан? In 1984, it was still Soviet Union. Yes, I a little bit released my microcatheter to have a safety when placing the coil. Safety distance. Okay, now we are out from the aneurysm. Just a second. Sometimes we need a little bit water. No, battery is off. Huh? Okay, now. Yes. Okay, I think it's detached. I hope. No. But sometimes the problem could be in the coil. Stolnistni aš пересал, долетался. Stolnistni класом. Yes, the anesthesiologist, the operating nurse is Zoya, and we have Aslajan anesthesiologist and the anesthesiology nurse, and video company on the first case presented. Oh, I think the problem with coil. Huh? Just a second. Maybe problem with coil. Just a second. I don't know what happens. It's a microplex, huh? It's a microplex. Just a second. It's not detached. Now it's detached. Okay. Yes, the surprise could be the the coils. Okay, now we will take out the headway from the aneurysm. Okay. 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 That's inside the MC. Maybe the first detachment system was also correct, but because of the coil, we couldn't see the detachment. It's very important to move slowly to prevent any problem. I think there is a remaining part of the aneurysm because of balloon inflation. The part is remain open. That's why I think better to place a stent. Stent like it can for. Okay. I think we can place Leo baby. I prefer to place Leo baby stent. Yes, then the slight negative part of balloon assistance. When you inflate the balloon, balloon is compressing the stent, and 2.5 by 18 is osnažta. The stent will be 2.5 by 18. We will place through the headway through the eclipse double lumen. Besmen geparin beresaš? Geparin besmen. Okay, this will be the. Bachtati besmen beresaš. As the anesthesiology nurse is Bacht. Okay. Because of human factor, I could send it through the headway, but it's better to cover the unnecessary instrument. I have seen the good practice from the Logan Spiel and the Besetter team. They're covering with the blue covers. No. Yes, the stent 18 usually may open through the eclipse double lumen, but if the Leo baby is 25 in length, then the better microcatheter, better to change the microcatheter for headway 17 or gamma. Because of the construction of the balloon, sometimes it's a little bit problematic to push the stent, but in this case we have no so much tortuosity, that's why we can place it through the eclipse balloon. I think it's a little bit distal. Now it's better. Okay, now it's better. I think it's not necessary to go with balloons through the stent. But we can take out the micro instruments. Okay. Just a second. In берешеш? Шприц 20. Okay, no problem. We'll do hijama, endovascular hijama. We will take samples of blood. It's a prophylaxis of thromboembolism. when you work a little bit long, then and when you work longer, and when you use multiple devices, then it's better to take out, aspirate some part of blood. Stop. It looks like there is some problem in ICA. I will do let's zoom. It's a Fubuki. Let's do it like this. Yes, maybe there is everything's okay, but it looks like some irregularity. Yeah? Is it? Okay. Let's do AP and lateral. The aneurysm is occluded and stent is patent. Timer қайтын қоса саласың ба? Timer обнулить етсін. Yes. Новыйдан қоясың. Yes, the stent were opened at 12:33, now for 34, 1 minute left. We will wait for 10 minutes, and if everything is okay, then we can finish. The next case, we are planning patient with the next case we're planning to treat patient with the ICA aneurysm, choroidal segment, microaneurysm. It's looked like carotid a little bit with changes. Huh? Stop. It might be previous changes, or it might be atherosclerotic changes. Okay, patient will be on dual antiplatelet. It should be okay. Now I will ask Davlet to do control angio, and let's wait for the control CT. After control CT, we can finish the live streaming. But on minute number 12, на 12 минуте еще одна ангиография. Okay, let's wait for the control CT. And next case will be in 20 minutes under local anesthesia. Microaneurysm. Okay. Dear colleagues, КТ можно показать. Thanks, Roman. CT is clear, brain is clear. As from protocol, we will wait for another 10 minutes. But from this point, we can finish the live streaming. It's just for our protocol. We will do control angio on the minute number 15. As казах thrombosis, but because of the first stent placed in vertebral, we can finish now without any problems. But the habit is habit. That's why I prefer to do control angio on minute 15 and then finish. See you in 20-25 minutes. Have a nice day. See you. Thank you for watching.